Again, today we're going to talk with you about how to launch a home-based business, a low cost with high returns. That's really what we want to kind of talk with you about here, because we're going to talk with you about the investment and then the possible ROI that you can see and how quickly you can actually get there. So that's kind of the topic and the discussion that we're going to have this afternoon. So I appreciate everybody joining us. Again, my name is Eric Auger. I'll be your business coach this afternoon. And it looks like we got some folks there from Phoenix, Arizona, from Minneapolis, got them all over the place. San Diego, California, Colorado. Good to see everybody. Thank you for everybody for doing that. I certainly appreciate that. I'll be your not only business coach this afternoon, but part of being just the co-host this afternoon for you, as we are joined also by the founder of American Business Systems. That'd be Patrick Phillips, and he'll be joining us here just shortly. Gosh, we've been saying this for the last 3 to 4 months there towards the end of the last year, that we are well in our 29th year here at American Business Systems. So, gosh, Patrick and I were talking, can you believe just in a little over 11 and a half months now that ABS will turn 30. So what a longevity that they've had, and it's good to be a part of it. And I've been proud to be a part of that. Now, one of the things that makes ABS who they are is because of the system, the billing system here. When you join American Business Systems, you're going to get everything you're going to need to actually do the medical billing, and everything from learning how to get your clients to the training to how to work with the doctors and their codes, and then obviously how to work with the system here. So you're getting everything in a business in a box, as Patrick would say. And speaking of boxes, you got all these other different boxes here. You really don't get these boxes here, but just kind of having a visual of all the different services and the services that keep adding in here. This is what you're getting from American Business Systems. This is all included with the investment. There is only a one-time investment. There are no franchise fees. There are no royalty fees to go along with this. So you're not having to be worried that you're going to be joining a franchise where you're going to have to keep up with certain things or for certain fees or anything. And if you are doing billing for a doctor, do you have to pay ABS anything on the back end? You do not have to do that. So there's just a one-time fee that Patrick and I will talk with you about. Speaking of Patrick, here is Patrick and his lovely wife, Linda. They become not only good people to work with, but obviously good longevity type friends that my wife Karen and I have come to know Patrick and Linda very well. And again, celebrating another 29 years in business as the nation's largest network of independent medical billing companies. So that is true. ABS is the largest that there is in the United States. Patrick has been a writer over the last years. Not only has he written books, he's written articles, but the three that we're showcasing today are How to Reprogram Yourself for Success, The New Thriving Medical Practice, and Cash Crunch to Cash Flow. The book that's in the middle, we're going to talk a little bit about it this afternoon. For those of you who are challenged about making sure that you're making enough money is what you think that you should be, the book, How to Reprogram Yourself for Success, is a great book that you can read about. And actually, it's Patrick's story itself and how he became where he is today. I mentioned that he is a contributing author for a magazine called the Billing and Coding Advantage magazine, along with our CEO, which is Adam Phillips, which is his son. And Adam is running the helm, and we appreciate all of his leadership here. Myrma, let me talk about this organization here. Now, when you start with us, and whenever you want to showcase who you are and you're out there marketing to doctors, the last thing you'd want to do is, hey, let me tell you where I got all of my stuff from. I got it from American Business Systems. That's not what you want to do. You want to be able to share with the doctor that you're part of an organization called MIRMA. That is the Medical Revenue Management Association of America. And MIRMA is the group that will actually certify you as a certified medical revenue manager. Once you complete all the training here with American Business Systems, then you're going to be a certified medical revenue manager, and you'll be able to put those initials back behind your name. And we're going to show you one of the places where you can actually be able to do that. And that's going to be on one of the books that we'll share with you here in just a little bit. So MIRMA is the organization, again, that will certify you and take care of you from there. And listen, folks, without any further ado, I'm going to ask Patrick to join me. We're going to get this thing kicked off. We're going to share a little bit of some information. Oh, there he is. Patrick, it's good to see you this afternoon. Up, you're muted still.
Wow, we're already in 2023. That's hard for me to wrap my brain around. When I saw your new logo there, the 29 years, I thought, man, has it already been almost 30 years that we've been in
Can you
business?
believe that?
There's not many businesses that stick around for 30 years, Eric.
No, not at all.
Not in today's world. But you
not
know
in
what?
today's world.
It's because this one is just about as solid as you can get when it comes to get through all the hard economic times, and one that actually makes people money. This is a rare business. It's kind of one of those little secret businesses that I used to tell people, look, my wife and I know we never leave the house, and we've bought a new house and a new car, but we don't sell drugs out the back door or anything like that. It's a legitimate business because
right,
as long as there's humans that get sick,
right,
they have to go to the doctor gets them well, and somebody has to pay the doctor, somebody has to bill somebody to pay the doctor, and that's what we teach people to do. It's real simple business when it boils down to it. It really is simple. It's just something that has to be learned. If you don't have any background at all, that's okay. Most of our people that we've trained, Eric, have not had any background at all in medical.
right.
Yeah.
Yeah, most people who have never been in medicine or healthcare at all have started this
Right.
business and been very successful. And obviously, over 30 years, there's proof that ABS and the other folks that have joined American Business Systems find this to be a recession type proof business. So people that are looking to see what type of business that they should get in. Obviously, ABS is one of those businesses that you can say, you know what? This one's recession proof. You've been through the ringer on certain things, everything from a pandemic to, what Congress comes out with all these different healthcare initiatives and people thinking that we're going to go to a single, payer insurance like maybe Medicare. And we have to understand that, groups like Cigna and Blue Cross Blue Shield and Aetna, those folks are not going anywhere. I mean, if you think politically, those folks have big pockets, deep pockets. They've got all their folks up there in Washington, D.C., making sure that they're going to stick around. So, go into a single payer here in the United States is way beyond, I think, our lifetimes and in our children's lifetimes.
Yeah, there's no doubt that if it did switch to that, Eric, there are medical billing companies in Canada that still do the billing for the doctors. So the doctors are going to still need help no matter what.
Yep, you bet. Patrick, I what I wanted to do today is I was putting together today, and I was thinking if I were on the other side of the webinar this afternoon and listening in, and I'd want to know, is there any validity to revenue cycle management? We're going to talk about it in those terms. Medical billing is, in the doctor's world, what's called revenue cycle management. Since we've turned from 2022 now over to 2023, obviously throughout 2022, there's been a lot of data that's been collected. But this is a great time to kind of see a snapshot of where revenue cycle management is, where it's kind of going, and is there a future in getting into medical billing and revenue cycle management? So I found this group here. They're the Allied Market Research Group. And they say and state here in their analysis, revenue cycle management market is expected to reach, I think that's $329 billion by 2030.
Wow. That's a big industry to be a part of, Eric. Not many industries are as big as healthcare, so that's a good start. And then, of course, it's growing at a compound annual growth rate of 12.7% in the next, through 2030. That is a huge growth for any industry. I don't know of any industry that's growing at 12% every year.
Every year. Yeah. I mean, close to, man, I would love to get that on investments.
Yeah, really.
Well, I'd put all my money into that one. And this is again from a little bit from there. And folks, you can see down here at the bottom of the slide, we've got their website there. So if you want to reach out to the person that invited you to the webinar today, might like to get a copy of this slide deck here, you can ask for that. We'd be happy to give that to you. But folks, this is what you need to be reading and researching on. So, but they just go on to say the revenue cycle management market size was valued at 97 billion in 2020 and is projected to be at 329 billion in 2030. And again, that's registering that annual growth at nearly 13% a year, Patrick. And that's pretty big. Now, understandably, that is global wide. That's everything that you would think about of everything whenever we talk about revenue cycle management from that standpoint. But there's another organization out there that we've used, I think, just about every year to kind of see what they forecasted and what they've looked back over the last few years. And there's an organization called Change Healthcare, and they do their kind of studies. And so we're going to look at the Change Healthcare 2022 Revenue Cycle Denial Index. Let's talk about what denials are first, Patrick. Let's deal with that, and then we can kind of get into the numbers here.
I think that is a great idea. Eric, could you just skip to 17, slide 17, because that actually shows what denials are.
Sure.
And I mean, it starts with the registration and the eligibility of patients who are coming in. Some patients are not eligible. Their insurance, is not going to pay for it. So that's a waste of time for the doctor,
Correct,
from his standpoint, because they're not going to get paid. So we've got that settled. I mean, we know how to solve that problem, don't we?
We certainly do. And folks, again, just simply a denial is a claim that has been processed, sent to an insurance company, and then denied. And through their study, and what we're showing you here are some staggering numbers here. Now, these numbers here that we're looking at right now are the registration and eligibility, where these denials are being created. Now, think about it. This, whenever you go to the doctor, they get your information and someone enters that information incorrectly into the doctor's billing system. So 22% of the time, that's what's occurring. And Patrick, that's a large number there.
Yeah, I mean, think about it. Almost a quarter of all claims get rejected by the clearinghouse. We'll talk about that here in just a moment. But the insurance companies basically reject these claims for all the reasons you see here listed in this chart. But a lot of it just happens right there when the patient's, filling out a registration form, or the office is trying to make sure that that patient is actually eligible to be covered by their insurance.
Correct.
And that can happen, of course, manually, which is why all that that's 122%. But we do it completely electronically. We tap right into the database of the insurance company, don't we?
Yeah, absolutely. Which reminds me that, folks, if you haven't seen a demonstration of the iClaim software, get back again with your business coach that you're working with here at American Business System and ask them to show you a demonstration. So what they're going to do, they're going to demonstrate to you what we're talking about right here. So when Patrick says, let's say that you that are out there on the webinar today, let's say that you got Blue Cross Blue Shield. Well, all we would need is your number from your insurance card. We can actually put that into our system. Our system will then go out to Blue Cross Blue Shield, verify that you're eligible to receive, healthcare benefits. And then if so, then the registration process, so we're doing two things at one time. We can actually take all of the data that's from the Blue Cross Blue Shield and bring it into our iClaim system, your first name, last name, your date of birth, your street address, all of that in, without you as the patient having to fill all that out and then someone having to retype that in. You can see where the errors can occur there. But if we can go get that directly from the insurance company and then populate that back into our system, that eliminates this whole first line here of where claims actually get denied. So people that are asking, gosh, is there a market for me? What's the real pain issue with doctors? Where are errors occurring where I could, as a medical billing company, help out with the doctors? This is that area right there, Patrick.
Yeah. And, Eric, as you know, we can also do a demo for our business owners, our licensees, we call them, because
Yep.
we license our system to people. But those people can ask us to do a demo for their prospective doctors. So if you've
Yes.
got a doctor that's interested and wants to see our system, our demo people that we pay right here in our offices, they will do those demos for those doctors. And Eric, that's one of the things the doctors are just blown away by when they see that eligibility done in
Yeah,
real
absolutely.
time, in a real patient data screen, that it's just sucked. We just suck that data right out of the insurance company's database. And now you don't have to worry about human error, right? Because
Correct.
the data has been pulled in from the insurance company's database. It's probably right in their database.
Absolutely. Yeah. Or at least it's the same. So they're not going to deny it because it's not the same there it is.
Right,
It's at
right.
their
It matches
their
up.
insurance.
Exactly.
Yeah, absolutely. I wanted to share this graphic. Denials are trending upward. I mean, from 2016 through 2022 and January through June. Again, this is the overall. So it says here the denial plans pain is denials continue to be frustrating, costly challenge in placing millions of dollars of revenue at risk for most hospitals. Now it says hospitals here because they're gathering data from all over that's why we call it the revenue cycle management global part of it as we're looking at here. But whether it's the hospitals or the doctor's offices, and you can see out of this particular one, where are the denials occurring? And again, 41% of those are on the front end. Now, Patrick, you and I both know that our system, the iClaim system, takes care of more than 90% of front end denial problems, because what's unique about our system is, and if you don't know anything about billing, I'm going to share something with you, so just bear with me. You have to have a clearinghouse inside, or you have to have a clearinghouse to actually process claims to get them to the insurance companies. Usually that's just a third party. It sits outside of most billing softwares. What's unique to what we have here, ours is built in. So we're able to handle and kind of see things. And since we're the clearinghouse, we get to see if there's a denial before we even submit the claim. That way we can handle and take care of those issues before the claim ever goes out.
Yeah, our system really was designed by a couple of medical doctors. This is over 20 years ago. But when they designed it, it was first a clearinghouse. They were clearing claims for all kinds of people, doctors and medical billing companies. They were doing the clearing as a service for them. And you'll pay for that, just like you will if you sign up with any other company besides us. You're going to have a fee for that clearinghouse. But they designed it from the beginning as a clearinghouse, and therefore they've got this down where we eliminate, like you said, 98% actually of all of those errors, because our overall rejection rate in our system shows to be about 2% or less.
Right.
And that means we're doing something completely different from what doctors are seeing done by other billing companies or even their own staff. They're going to get a lot of rejections. You got back end of 34% errors, and then mid-cycle 17% of them can get, and then unknown even 88%. Right. So those are the kinds of things we have solved for doctors. Absolutely. And that puts more money in their bank account.
Yeah, a question came up here. How many clearinghouses operate in the United States? I think, Patrick, I don't know, 20 plus clearinghouses or so.
Yes.
I can't keep up with all of them.
No, because sometimes one will, go out of business, or others start up. And so that number is changing, but it's over 20. And that means that if you had to set up your own clearinghouse, folks, that means you got to go out and research all of those, find out which ones you think might be doing the best job, best customer service, et cetera, denial rates. You have to research all that to make a decision as to which one you want to use. We've already done that for you. And since ours is lower than any of the clearinghouse rates that we know of out there, and we're the only system that has the clearinghouse built into it, we seem to be the best choice.
And again, it's that clearinghouse that allows us to do what we talked about earlier, just putting in the information about you as the patient and having that Blue Cross Blue Shield number or Aetna number or even a Medicare number, putting that into our system and doing what's called an eligibility verification. Again, through our clearinghouse, we could go out there. We've got that capability that's interface in with those insurance companies, see that, make sure that that patient is eligible. If so, again, pull their data over without, again, hand typing any of that information. So again, another thing that Change is saying out there, what can providers, how can providers take charge? Well, Patrick, most doctors would love to see denials completely go away, but you can't do that. Obviously, there's about 18% of those that are obviously unavoidable, but 51% situationally can be avoidable. That's what we're talking about there. Situationally, we can, if you're using the iClaim system, we can go out there and go get that. But 31% are completely avoidable.
Right.
So Patrick, I mean, when we start talking about, we're collecting about 98% of all claims that we go through our system, we're actually beating the numbers here that we're even looking at here on this graph.
Yeah, it's amazing how far advanced we are over any other, billing companies, software, clearinghouses. We've got them all beat because we've been doing this for, 30 years now.
Absolutely. Yeah, absolutely. So also staying with what, again, that Change is saying. Now, we're showing this not because we're pushing anything that Change is doing. They're a completely third-party vendor out there that does a lot of data research and all that kind of stuff. We're saying this is not what ABS is saying. We're not trying to sell you on something that, that's a solution that is non-proven. But they've got a three-pronged strategy: people, process, and technology. And Patrick and I were talking about this earlier. I mean, I could go through and read all of these, but let me tell you how this applies to you, those that are watching the webinar today. You need to have the right people that have the right processes, that has the right technology.
Yeah, that's really the solution that we've come up with for this whole medical billing field, and why our people are so successful. Because if you have the right people, the right process, and the right technology, it's a winning combination.
Yes. Yeah. And so we've got what we do. We could take you, make you the right people, because we're going to give you the right working process. That's why it's called American Business Systems. And then we're going to hand you the right technology. And so again, get back with the person that invited you and see the demonstration. That's what you can say. Wrapping up with two people from Change there. And we don't know these people. We just found this information and thought, man, this is great information for we can share with you as our audience, kind of just share with you what they're saying. Patrick, you want to share a little bit what Nicholas is saying about the denials here again?
Well, yeah, he's just basically saying what we said. 1 in 4 denials originates in the registration and eligibility. It's time to take a hard look at the dollars and time that these denials represent and focus on denial prevention in this area. So folks, we've done that for you through the technology that we have with NextGen that's all built into our system. It's going to eliminate, like you said, Eric, probably 90-something% of all of those problems. So this is extra money in the doctor's bank account that they wouldn't see otherwise if they didn't have you doing their billing.
Absolutely. One other quote we'll hear from him is from Bryce Bruner, and he's the Senior Director of Product Management Analytics there. He says, when you look at the root causes of registration and eligibility denials, which is what we've been talking about, most aren't straightforward denials. They're more nuanced, such as coordination of benefits and benefit maximum issues. Again, our system actually handles that. So those types of denials are hard to quickly see if there's an issue. So it requires a bit more due diligence. Well, I think we've done that here.
Yeah.
But that's been from Change. And again, I want to kind of shift a little bit to some other folks that are out there talking about high rates of denied claims. This group is the Healthcare Business Management Association, which some of our business owners here at American Business Systems are associated with the Healthcare Business Management Association. And they've stated that they've seen denials as high as 35% or higher, Patrick.
Yeah, wow. That's just very expensive if you think about it, because they've got to follow up on those claims if they have time to do that. Some doctors and office managers don't even mess with the rejections. They just write that off at the end of the year and think, you know what,
Yeah.
that's just a part of doing business. But they don't have to do that. That money would be put to better use if it was, coming in to the doctor's office from the insurance companies. And that makes you more money as well, folks, because as one of our business owners, one of our licensees, you actually can charge whatever percentage that you think you need to charge for the work that you're going to do. Now, we can help you with those pricing things once you find clients out there, but believe me, you don't want to lose, 35% of your income.
No, nobody does. Absolutely. Nobody would want to lose that much money in an investment. So that's completely understandable. And that's what doctors are thinking. They're losing part of their investment on just denied claims. And again, the government says the same thing. It can range from 6% to over 30%. So again, I encourage you today, those that are watching today, get a copy of these slides here. We would love to be able to get these to you, and you can do this. So the question must be coming up in your head, why would a doctor outsource? So Patrick, people wonder, why doesn't a doctor just get good billers in their office? Why do they need to outsource? Why would the doctor want to take that outside of their office? Walk them through this chart here.
Yeah. So what we did is we just basically took what it would cost you to, what it would cost a doctor to outsource to you. That's that very first line there. This 54,000 here. Ooh, I think I'm trying to draw on something that I'm not able to draw on for now. I've got to change something here. Is that drawing? No, that's drawing something else. Okay. Well, forget that.
I'll make sure that I can draw for you. Let me see if I can do that. So let's see. There we go.
Yeah. Okay. There you go. And so we got that figure. If you look at the first column there, assuming that you're doing 100 claims per week, that's only 20 a day, at $150 per visit, times 52 weeks, times 7%. Now the 7% just came out of our head. That's about the average out there that our licensees charge, but that could be lower. I've seen as low as 5%. I've seen as high as 9% or 10% even. But 7% means, if you do the math there, that you're going to be paid by the doctor $54,600 based on the amount of money that you collect for that doctor. But if they do it in-house, look at that column. Wow, that's a big difference, isn't it? See that 95,000 down at the bottom there? That's what the doctor's going to end up paying, with all these hidden costs that you see in your payroll taxes, training costs, benefits, hardware, software, all of that. The difference there, Eric, is a huge amount of money that I'm sure the doctor would rather put in their back pocket.
Well, yeah, even the difference between just these two numbers right here. If they've got 1.5 employees that are doing the billing, because you always have someone that has to do a little bit of the work, and you got to look between those two numbers right there. That's there's a savings there just getting it out of the office without any of this other numbers here. So again, folks, just getting it out of the doctor's office can be an incredible savings for the doctor, as you can see. So Yarvi is asking, or Yariv is asking, because Patrick mentioned about charges and what do they do if they can't collect? Do they write them off as a loss? And that's what happens. They've got to take some advantage to that, so they might as well write it off on their taxes as lost revenue. But the doctors would rather have that money, pay maybe a little bit of taxes on it, and not waste all of it on 30%, plus having to spend money on taxes as well. Right. Yogesh is asking, what is the 7% for in the first row? Well, that is the that's the percentage of what you would charge a doctor on what's collected. And we're going to actually go through those numbers here just in a little bit. So this will actually even make a little bit more sense here in just a moment. So
Yes.
Patrick, we talked about and named this, learn how to launch a high return cloud-based business, but also it's a low investment. And now let's talk about the investment. The investment is 28,990. It's right at 29,000.
Right.
Yeah.
We just rounded up. It's $29,000. But folks, if you look at the franchises that are out there, that is a low investment. You can spend $75,000 to open a sandwich shop. So this is why people have to realize that you could either start all this on your own, do all your due diligence, try to make your connections with all the different technology companies that we have, set up your own clearinghouse and so forth. That's something you could do on your own, but why would you? If you can invest this money and have it all just kind of basically a proven system, just, shipped to you basically in a box, that's the only way to get a business like this going.
You bet. So again, folks, for those that are just getting involved in entrepreneurship and you want to know what ROI stands for, it's just a return on investment. It's what you've invested and then how quickly you can get that money back. And so we've kind of broken that down into 3 basic areas of your return on your investment. Obviously, it's the investment in and of itself, the return, and then the success to get you to where you need to be there. So again, we are going to be right up front. We're talking about the investment here. It is $28,990. And again, we don't have the time today. We're already got about 25 more minutes left in this webinar. Boy, time does fly pretty quickly. Yeah. To go over everything that you get for that. But everything that Patrick and I have talked about, everything from the training to all of those different services that we showed you at the beginning, your ongoing training, your support that is for a lifetime, that's all included. You never have to pay ABS another dime for anything else. So again, we want to talk about what could you expect on a return. Now, we're going to do the math for you here in just a moment. But again, trying to take the lowest end to the highest end, you could earn anywhere from $30,000 to $39,000 off in your first year. Actually, it could be a little bit more than that. And you're going to see that here in just a second here, where we've actually you can find yourself even higher in your investments. But this is just with one doctor. And so what we're trying to do is just show with you that typically within 1 year, you should be able to see a return on your investment anywhere from $35,000 to $65,000 with just one doctor, So I'm going to direct everybody over to our website, which is just the absystems.com. And if you'd go all the way down to the bottom of the page there's a spot there that has an income calculator. Now, I know this is a little bit small for most people, but again, what we've done, we've kind of worked it to where, Patrick, if you want to kind of talk about this, I'll even see if I can go out there on the website itself and see if we can't just pull that up, right? And we can just do it right with everybody on the webinar today.
Okay, well, we've just kind of used the same numbers that you just saw in that chart. What ago, billing rate. Remember, that's your choice. It's your business, so you can charge whatever you want to. Now, again, if you pass that by our support people, we might look at it and maybe you're going to charge, 3%. And we look at your figures and say, you know what, you'll be losing money if you charge that low. But if you try to charge, 10 or 12%, you might not get the account. So you need our guidance, our 30 years of history doing this, to where we actually can give you some advice on that. But just take my word for it, about 7% is average. And then the average claim amount in today's world, it's you can hardly see a doctor for less than $150. Again, you can change these numbers to anything you want to if you're out there on the site yourself. And then the average number of patients, we see with 25 each day. That's 25, that's 20 to 30 daily patients. That's a good rule of thumb, at least. And some doctors will see more than that. I've been in a waiting room, Eric, where there were more than 25 people in there to see the
Right.
doctor at the same time. And then, so the yearly projected income for this particular situation is the 68,000 that you see there at the bottom.
Yeah. So folks, you can come in here and play with these numbers. Say that you want to be at what Patrick mentioned earlier at 5%. That shows you right there at 5%, $150 per claim, 25 doctor seeing 25 patients. That's $750. So again, go in here, and this is on our website. It's called the Income Calculator. Go in there and play with these numbers. You can even hit it at 6%. And let's just say you want to put, $100 in there, still seeing 25 patients. That's still $40,000 right there. So when people are asking us, hey, what's my return on investment? How quickly can I get there? This is with just one doctor. And so without, kind of pulling back the veil here and not, knowing that we're not trying to blow smoke, to anybody, let's again, just kind of take a look at it from, just what it looks like straight on. So again, if you've got one doctor, again, that's seeing 25 patients a day at $150 per patient, you can see that this doctor is generating about $3,750 per day. So think about it that way. So the doctor needs to average, I don't know, Patrick, anywhere from $2,500, maybe up to $4,000 a month, a day in revenue. I mean, they've got all their overhead. They've got office buildings and staff and everything else that they've got going on.
Yeah.
So they're charging, obviously a doctor's appointment is $150 to $200. I don't think I can get out of there at a doctor's office any less than that. Then you doing the billing at 7%, just divide that. Take that $3,750, divide it or times it by 7%, and you're going to get $262 a day. Patrick, that's what an ABS licensee or an ABS business owner is going to make per day. And let's just stop here for a minute. How long is it going to take you to do that? I'll even say less than 2 hours a day. So, that's pretty doggone good money if you think about it. It's $131 an hour. And that would be part-time work if you think about it.
Yeah. Once people start doing this work, they realize that there's just not that much to it. When it's electronic in a computer, you basically are just plugging in a few numbers, especially if it's a repeat patient, they come back for a second time. You don't have to put in all the data. It's already there. All you do is just change the codes that the doctor gives you for the treatment and the diagnosis, and there, boom, you're done.
Yeah, you got it. So again, we take that number times 5 days a week times 52 weeks out of the year. There's where you get the $68,500 per year per doctor. So folks, your potential earnings, again, with just one doctor is $68,500. So again, most people, Patrick, average 4 to 5 doctors. So I just took it times 3. Most people always are, since I've been working with you, most people that are entrepreneurs, they're always thinking, how can I make at least $100,000? I think if I can make at least $100,000, I could probably quit my job. I can do this, maybe can grow the business a little bit. So folks, if you can see here, you could be making nearly $250,000 with just 3 doctors. You're not far off of that from, in this business with an investment less than $30,000 as an initial investment.
That's we should go up on the licensing fee. Eric, you just convinced me that we're way underpriced for what this thing can earn people. And as you know, these are not just made up numbers. We get all these numbers from our licensees. In fact, if you watch some of the interviews that I've done in the past with people, you'll see that some of them are earning way more than $200,000 a year. So not everybody's going to earn that kind of money, Eric. I mean, we know that there's always people who like to keep their business small and manageable. They don't want to hire people, even remote workers. They just want to do it all themselves. But why couldn't one person handle 3 doctors? I mean, if it takes 90 minutes a day, that's a short day even there, and you're still making, in this case, over 200,000 a year.
Yeah, you bet. So folks, again, and again, you can go in there and play with those numbers yourself on the income calculator. Just go put in the numbers that you want to look at. Maybe you might feel a little bit more reasonable at. Maybe you want to be at 5% or whatever. But again, we took a number at 25 patients. You know, most doctors were going to be seeing anywhere from 30 to 35 patients a day. So even those numbers are a little bit low. Now, Andy's asking a couple of questions about coding, and we're going to get into that here. Matter of fact, I'm going to go ahead and put this slide up here. Andy's asking, do you get certified as a medical coder and biller, and how do I learn these codes? So we're going to help answer a little bit of that right now, Andy, by talking about the different services. So to help Andy answer his question there, these are 2 little boxes here at the very top here. It says AuditGuard and CodeWrite. Now, these 2 are the services that have to do with medical coding. Now, you do not have to learn medical coding, and we're going to show that to you here in just a second, that the CodeWrite is actually all managed by our services through certified professional coders. So that's a CPC individual, so someone that has that. So you're going to be just fine, and really not having to worry about that too terribly much. So moving on to the next little slide here, Patrick, these are all the multiple income streams here for each of the people. And you and Adam are always looking to add more streams of income for our folks here at APS.
Yeah, you know, the amazing thing, Eric, is that, of course, at first we just taught people how to do medical billing. You know, because we had all the coders that could help them with coding, they didn't have to worry about that. But then we had licensees come to us about different things that, you know, like collecting money from patients who owed them money. How do we do that and not, you know, really tick off the patient? And so we came up with Quick Collect, for example, that you see down here. Oh, there you go. And that service that you can offer to doctors is one of those many services that, again, they're all optional. You don't have to offer any of these, but if you do offer this one, you're going to make some money on this as well, helping to collect that money from the patients, not just the insurance companies, but it's all automated, folks. This is hard to illustrate here, but this is an online cloud-based system that's built into our billing system to recover those past due accounts.
Yeah, absolutely. I have to say, Patrick, I had a birthday yesterday, and I had one of my doctors that I was seeing actually sent me information about my birthday and said, just want to tell you happy birthday. But this is what's called AutoCard. Now, this is an automated. Now, I got an email from my doctor, but boy, it'd have been nice to get something in the mail. And this is what AutoCard does. You talk about, to me, just any touch from the doctors outside of just getting a bill is a nice thing to have. And this is what AutoCard is. And this is what helps the doctors truly be able to communicate very well with their patients.
Yeah, Eric, I think I have shown this in the past. Let me see if I can choose no background here at all on my video just for a second. I wanted to show people, I have some of these actual cards here so people can see that they're real. These are cards that we've had already designed for you that you can mail out to doctors to get business, but you can also offer these cards to the doctor to send out to their patients.
Yep.
They're real greeting cards. Here's one right here. And as you can see, it opens up like this. And look, there's a message on the inside that you can create your own message. You can edit this any way you want to, add your logos, pictures, you change the fonts any way you want to. It's a terrific way to stay in touch with somebody and give them something that physically that they can handle. You know, when you get a card like this in the mail, Eric, it's in an envelope that's shaped like this. and everybody knows that that's a greeting card of some kind.
Sure. Yeah,
So it gets
absolutely.
opened. It does work. We use it ourselves as a company, and we've designed a whole campaign of these cards that once you have made some touch with a doctor, you put them in the database, and these cards go out one a month, every month on the same day automatically. It's a terrific follow-up system to keep your name in front of a client.
You bet. Now, getting back to Andy, here is Audit Guard. I'm going to share this in line with CodeWright, but Audit Guard is the every doctor is under the Medicare microscope, and obviously, if they're not coding properly, they could be fined up to $10,000 for each of those infractions. And Audit Guard provides an audit of the physician's current records by a certified medical coder. Now, that's on the preventative preventative side of medical billing, because one of the things you may want to offer, and again, someone's just asked, how much can I make selling these additional services? You're going to need to get back with the person that invited you here. And actually, we're going to show you that you can get a downloadable resource, and we'll show those numbers to you as well. But anytime that you approach a doctor and you give them a service, you're going to make money on top of that, including with, again, CodeWright. Now, this is, again, if a doctor, let's say like a surgeon, that can't write down their notes, or they don't have a scribe there in their office and they just want to dictate everything, and someone's going to need to convert the diagnosis of what the doctor is saying and make those into medical billing codes. Again, we have certified professional coders that will take care of all of that and provide that service for you, obviously for the doctor, for coding services. So when we say that we have everything that you need, and you do not need to go to a school to become a certified coder, you don't need to go to a school to become a certified biller. Patrick, we really do have everything that everybody needs, because again, we've taken people from all different backgrounds and service lines of people that have come into this business, never have any inkling about what's going on with healthcare.
Yeah, no experience or training whatsoever. So we really do take people from scratch and teach them this whole business. Now, as you'll see here in a minute, we also have a money back guarantee, which means if you go through our training and for some reason, any reason you don't like it, you can get your money back. Yeah. Hey, Eric, here's a good question from Caleb. He says, what's the potential of getting clients in this business? Have you had franchisees who failed to get clients? How do you help with that? Caleb, I'll be straight up with you. Yes, we have had people who failed to get clients. Now, when we dig into that and start researching that with them, sometimes we find that they didn't quite follow what we trained them to do, did we, Eric?
Right. Yeah, and a lot of people get into this business and they think, well, gosh, if I just put my website up there, the doctors are going to come flocking to me. And that's what Patrick's saying, that they're not following the system that we have. So therefore, you need to make sure that you're following all the services and what you're going to do. This is your business. And so a real entrepreneur will do what they need to do to create their business. And we're giving you the business vehicle, but you got to start it up and drive it. But we're going to be here to help you with that, because again, we do feel like we have the best advantage out there of getting doctors paid. And folks, y'all remember we were talking about that clearinghouse, and we've kind of embedded it in here graphically so you can kind of see what it looks like there. But if everything to the left has to do with the patient portal, the doctor's side of the electronic medical records, which is called EMRX, but all of that gets dumped into, again, the iClaim system. And because of the clearinghouse involved in that, again, we can go out to the insurance companies, get information, bring it back in, process the claim, and then be able to get that back out to the insurance companies directly, making that turn of getting those doctors paid pretty quickly.
And the doctors love that, right? Because the sooner they can get the money, that's called cash flow. It's turnover.
That's correct.
You need to get paid fast so you can continue building your practice and paying your people.
Jay is asking or saying the word is that ABS tech support is truly great, which is essentially the lifetime of the licensee. Is the ABS can constantly improving the components even further all the time. We're always looking to improve. We're always looking to do things better. And one of the things that was done probably the best of all is helping people get their first doctor. So we're going to spend the last 2 to 3 minutes here on how we actually help you get, again, your first doctor. And that's so important because you need the advantage. So when you become an American Business System business owner / licensee, you're going to be partnered with Dr. Vicki Rachner, who co-wrote the book, The New Thriving Medical Practice. Patrick, tell everybody how important this is and how this helps get people set up for success right out of training.
Yeah, folks, you're looking at one of our, I would say it's proprietary because I don't know of any other company that provides this kind of credibility for you. Think about the credibility of having your name right there on the front cover. I know it's kind of hard to see there, but it's right here. Oops, I just erased it, didn't
I? I've already got it up there.
Okay, sorry. And as you can see, your name is right there. Now, don't worry, we've already written a foreword that's very generic that you can use if you want to, or you can write your own with our guidance, of course, and approval. But the point is that you are now on the cover of a book with a doctor, Dr. Vicki Rachner. You can Google her name if you'd like to see what all she's done out there on the internet. She was a general surgeon for many, many years, saw hundreds of patients, and then decided that she wanted to do something a little different. So she started her own consulting business to help doctors to build their practice. So she's partnered with us and therefore with you to be able to have your name on the inside there. As you can see on the title page, your name's there, and your contact information is at the end of the forward. We're showing that on the right there. That is your name, your web address, your phone number, your whatever you want to put there, email address. That's your contact information. So folks, these books become like a business card. Now they cost a little more than a business card. This book sells for $24.95 on Amazon, but you get to have it when you run out. I mean, we give you 28 copies, I think, of every one of our books, personalized. But when you run out, if you run out, you can reorder these for less than about $4 a book, a paperback book with your name printed on it and in it. There's another example of a book. My son, Adam, wrote this one with Dr. Rachner. As you can see, we put your name right on the front cover with this bright yellow seal that tells people this is compliments of, and then it has your company name and your web address and so forth. And then there's, I think, one other booklet that we've come up with. Here we go, 10 critical questions for physicians in private practice. This one was written by Dr. Rachner, but your name can be printed right there on the back cover, right below her little blurb there. You see that on the right with your company name and contact information. Folks, again, nobody else has this. Nobody else has done this kind of thing. Why? Because it's expensive. We've spent a lot of money developing and having these books developed. And we've done all that because we wanted to give you the right tools to go out and get clients ASAP.
You bet. And Patrick, as we kind of wrap up today, we hopefully met our challenge today of learn how to launch a high return business. You can see that high return business can be 1 or 2 doctors. And so we have some training that we're going to kind of talk with you about, some next steps of some things you can do. But Patrick, before you go, why don't you talk about the money back guarantee? You mentioned it earlier, so let's kind of talk through that, and then we'll wrap up here with some of the next steps that everybody can do.
Yeah, I got to thinking a few years back, Eric, that if I bought this from somebody, paid the licensing fee of $29,000 and got into this business, if for some reason I didn't like it, because you can't do all your research. You got to get into the training and see all the aspects of the business. I thought, well, what happens if I spent that money and then I don't like it? So I came up with the idea of offering an unconditional 30-day, 100% money back guarantee. It doesn't get any better than this, folks. I don't know of any franchise or business opportunity that you can invest in that they will give you your money back within the first 30 days. It has to be within the first 30 days, because you'll know by then. You can go through our training completely, all 10 modules. You can go through that online with our trainers, in less than 3 weeks. So by
Right.
the time you've gotten through the training, you will have seen every aspect of our business and can make an intelligent decision. So I tell people, look, think of this going through our training as part of your due diligence if you want to, because again, if you can get all your money back, there is no risk.
There you go. Absolutely. All right, Patrick, we're going to go through these 6 steps here, folks, of
Eric,
what you could be.
I'm gonna let you finish up with that, because as
You
you know,
bet.
I have another call here in just a few minutes I got to get ready for. So, hey, thanks for putting all this together, Eric. Very clear. I like it.
Good. Thanks, Patrick. We'll see you next time.
All right, take care.
Absolutely. So, folks, everybody stay with me here as I kind of wrap things up, and then I'll answer a few of the questions that are here. But the next steps are, someone was asking earlier, and I can't remember who, so forgive me. But what about what kind of money can you make on the other services? So ask your ABS business coach that you're working with here and ask for the research guide. That's a downloadable PDF research guide. Each one of them, each service that we have has the potential money that you can make on each of those. It also has some descriptions of the websites that you have, all the different marketing materials, some of the testimonials from a few folks there. But you're going to want to get that research guide, go over it, research it, look it over with your business partner, pass it around to people that you're asking questions and you trust as good counsel people for yourself. Then every Wednesday, obviously, we do a webinar right through the holidays, right through the Christmas holidays, to the New Year's holidays. We haven't missed one in the 15 years I've been around here to have a Wednesday webinar. But we've cataloged all those, and we've got those all archived on our YouTube channel, youtube.com/YABS. Go out there, go check it out. You'll get to hear from other people that have actually that we've interviewed. And we'll be interviewing some folks here right at the first of the year, some other ABS licensees, and just kind of go over and listen to their story. But we have all different types of topics out there. So go out and check that out. Speaking of licensees and their interviews, why don't you talk with a few folks? We do have a reference list that we will put you in front of, let you talk with them, set up some time, maybe even do a Zoom meeting with them. You just coordinate that with them. They'll be happy to have that opportunity with you. I've already mentioned this earlier about the live demo yourself. I would encourage everybody that if you're going to get into this business, at least look and see what's going on with the software. So get that download, not downloaded, but get back with the person that you're working with here. They will schedule a one-on-one demo with you to walk you through the iClaim platform and the EMRX platform. And then look over the purchase agreement. Get familiar with it. If any of you have done any research with any of the other franchises out there, you know that most of those purchase agreements are fairly long. Ours is 4. I think it's gone up just to 5 pages. We added some more information in there. But it's not that difficult for anybody to read through. Matter of fact, that money back guarantee is actually on the first page. So you want to take a look at that. Have your attorney look it over, or whoever you got in the legal area to take a look at it. Make sure that it says what it's supposed to say. And then get ready with your funding and get ready with your training. We're ready to train you when you're ready. Patrick mentioned that training can last a couple to 3 weeks. Enough time, give you that 30 days to go through the entire training. Have other people join you on the training, and if at the end of the 30 days you feel like this is not for you, you can certainly ask for your money back. And there's no doubt. But that one-on-one training is done online with a one-on-one instructor, somebody that's actually a medical billing company. So it's not somebody that we've trained to train you. It's somebody that we've trained by somebody else that was already doing the business. So it truly is taking that opportunity. You want to have someone eat for a lifetime, teach them how to fish. That's what we've done. We've used that same principle here. So give us a call here at 866-565-8413. We'd be happy to talk with you. If you don't know who your business coach here is, call us. We'll make sure that you get to the right person. So I'm going to start here at the bottom, make sure I don't miss anybody. But Yarb is asking, can I get today's presentation? Yes, we have recorded it. It will be up on our YouTube channel in the next day or so. If you want a copy of this, the slide deck, get back with the person that invited you. They'll get you a PDF copy of that. Lawanda is asking, is there data to show how saturated the market is by state with claim system? You know what, that's going to be difficult because that changes all the time. But let me say, every doctor has someone doing their medical billing. Every one of them, they have to. Either they're doing it in-house or they've got someone outsourced to it. So if you're asking the question, is medical billing saturated? In a sense, it is, because doctors have to do medical billing. But if you're looking, if the area is saturated with medical billers, you got to remember that, and I'll share this with you as a personal story. I'm here in Texas. My first billing client was not here in Texas. It was actually in Georgia. And then my second client wasn't even here in the Dallas-Fort Worth area. It was on the east side of Texas. So you don't always have to have doctors within your own state. We're going to show you how to get that information out to other people. And who knows, if a relative in a different state or somebody else that you know in a different state may not know of a doctor who's looking. That's how it's done, and we'll share that with you. Anonymous attendee is asking, ABS targets the individual healthcare provider or small hospitals. Who is ABS customers? Your customers are going to be individual providers. Those are going to be your primary care physicians, cardiologists, all your specialties, anything to do with nephrology, which is kidney stuff, and all the different things out there, dermatology, those are all within your market. Hospitals, they bill on a completely different form. That's called a UB04 form. We're billing on what's called a CMS 1500 form. It's what's called the professional form, professional billing. That's what we're doing billing for. So anybody that is a chiropractor, PCP, any of the specialties that are out there, any of those bill on a CMS 1500 form. For those that are want to do dental billing, we do have a dental billing platform, but that's done on a completely separate form, completely from what we're talking about there. Because dental billing and medical billing are two separate things there. So if that kind of came up there, I just wanted to share that with you as well. And then last question, do you have a monthly industry update email or similar educational informational blog? Yes, if you'll go back out there on our YouTube channel, go find one of the webinars that talks about what you get within the package, because we dive into a little bit deeper about what kind of support that you get. So the support that you get, we typically have 1 to 2 webinars specifically for our business owners on the different services, what's going on in the industry. We've got a lot of things that are going on like that. So we keep up with our licensees or / our business owners like that and keep that going. So we've got a lot of additional education. Plus we've got our ABS LSS, that is our licensee support site. And that's strictly for our business owners. It is a private website. Plus we have a private website for our private organization on Facebook, that all of our business owners there chime in on different things, ask questions. So we've got plenty of different types of support, whether it's social media, whether it's webinars that we do like we're doing today, that are strictly for our business owners, or just the one-on-one coaching or personal help that you might need. We have that. It's only a phone call away. As a matter of fact, it's the same number that you're looking at. And instead of just pressing 0 to get to an operator, you press 2, that would get you to support. So if you try to call support today, they are going to look you up. You're not a licensee. They won't be able to answer your questions, but they'll forward your information to the person that needs that can actually help you out. Well, folks, listen, it's our first webinar of the year. We've got 51 more of these to do for this year. We look forward to doing those for you. Hopefully you'll be joining the ABS team family before then, but it's been my pleasure. I know it's been Patrick's pleasure to host you this afternoon. Y'all have a great day, a great and happy new year, and we'll see you next Wednesday. Appreciate everybody saying thank you, and we look forward to doing this again next Wednesday. Thanks, everybody. And remember, get back to the person who invited you, ask them all those questions that we just shared with you, and we get the slide deck, and we'll be here to help answer your questions. Y'all have a good evening, everybody. Thank you for joining. Bye-bye.